You, as the patient, it's your responsibility to understand your particular plan. What happens after you meet that deductible? Do you roll into a 100% the insurance pays for everything? Or is it a 80-20? You know, what happens after you meet that deductible? Understanding all of those things before you start to see providers, and it doesn't matter what provider it is. Understanding that will save you a lot of headache. One thing that I'm finding lately is that's really frustrating for patients. They finally get to the point where they're like, you know what? I need some help. I need to see someone. They build up the courage. They find somewhere that they want to go. They call, they get scheduled, they sit down to see someone, and then they get their first statement from a practice. And they're like, what the heck? I have insurance. Why am I getting a bill? And it's because there are so many of us who really don't understand insurance and how it works. We get these cards in the mail and we often think that we can treat them like credit cards. And they're not credit cards. And they're not all created equal. You could have 4 different people with Aetna and everybody has a different plan with different terms and different conditions. So it's important to understand things like what your deductible is, what your copay is, what your maximum out-of-pocket spend is. These are very familiar words within the insurance industry when it comes to health insurance. So a copay, a lot of us are familiar with, right? You go to the doctor, you pay a copay. It's usually on your insurance card. It'll say it on the front for some. Then there's a different copay often when you're going to see a specialist. And usually a specialist is anybody other than your primary care doctor. So a specialist would be a podiatrist, a psychiatrist, an endocrinologist. Usually they have a gist at the end of their name, letting you know that they specialize in something. They're not a generalist. They're not a family doctor. So those often, depending on your insurance, could be 2 different copays. You go to see your family doctor, $15 copay. You go to see a specialist, $35 copay. Or you may have an insurance plan where it keeps it the same. Whether you see your PCP or your endocrinologist, it's the same copay, which is great. You, as the patient, it's your responsibility to understand your particular plan. And unfortunately, then it's not even that simple because then that plan changes every year. And not all of our plans change the same type of year. You could be with an employer where, okay, January is when we start our insurance. That's a good majority. But you have some who it's a June start. June is when our insurance renews every year. So knowing when your insurance is effective, when that plan year starts and ends is important because that's when the clock starts ticking to meeting your deductible, which is the next thing. So a deductible is the amount of your insurance that your insurance wants you as the patient to spend out of pocket before they themselves will start to kick in. So not to be confused with your insurance premium, which is how much you spend per month just to participate with that insurance plan. So far we've got the premium, which is what you spend just to be part of the plan. Then you've got your deductible, which is how much you as a patient have to spend before your insurance will start to also kick in. And your insurance premiums do not count towards your deductible. Okay, so a lot of people get confused with that. Well, I pay $500 a month and my deductible is $1,000 a month. So by the time I pay my insurance twice, I've met my deductible. That would be great if that's how it worked, but that's not how it works. They do not count your premiums towards your deductible, right? So we've got copays, we've got insurance premiums, we've got deductibles. So what happens after you reach your deductible? Okay, your deductible is $2,000. You've reached your deductible. Now you have to know with your plan, what do they say happens after that? Some plans will say, okay, after you've spent that $2,000, you've met your deductible, we will cover everything 100% after that. That's great. That's wonderful. However, you have some plans that will say, we will cover everything 80-20, meaning we'll cover 80% of the cost and then 20% is for you. So now you may have someone go to the doctor and you pay your copay. So you come in, you pay $20. That's your copay. Then you have a deductible. That's $3,000. And so far you've paid $1,000. So you've got $2,000 left before you meet your deductible. You go to see the doctor and they charge $200, but they have an affiliation with your insurance company and they say, hey, listen, because we're affiliated with you, Aetna, Cigna, Highmark, in our area, Pennsylvania, Geisinger, what have you. Anytime we see one of your patients and we charge them $200, we'll actually give them a discount just for being affiliated with Aetna. We'll charge them $175, and $175 is the agreed amount that we agree that we will accept for this service. Even though we charge $200, because of the partnership, we will agree to accept $175. Okay, so you come in, it's $175. You have a $25 copay. So now out of that $175, you have $150 that's left. $150 is what the insurance would cover if your deductible was met, but your deductible has not been met yet. So that entire $175 less that $25 copay that you already paid, right? Because you usually pay that at the time of your appointment. The $150 is going to be adjudicated after it's been submitted to the insurance and they've seen, okay, you've seen such and such at this appointment at this date, this CPT code was submitted, this is what you were seen for, this is what they did. Now you owe $150. This is usually when patients are like, but I have insurance. Why am I getting a bill for $150? That doesn't make any sense. You didn't do it right. You got to bill it again. Send it again. You're not billing my insurance right. You have to understand that deductible until you meet that deductible. Now, your insurance, you might say, well, what's the point of sending it to the insurance if I haven't met my deductible and I'm going to have to pay it anyway? What's the point of using the insurance? Well, the point of still using the insurance is you're still getting credit for the fact that you're paying $150 for this appointment and then $150 for that appointment. And $150 plus $150, they eventually add up and you get to the $3,000 deductible that you have. So we can say, okay, you've met this deductible and you've paid this. So the whole time they're giving you credit for the fact that you're paying it, but you still have to pay it out of pocket, including your copay, including your premium, until you meet your deductible. And then after you meet that deductible, now that same $200 that may be charged for that visit, now that you've met your deductible, if it's an 80-20, now you may have to pay the copay, and then now you just have that 20% co-insurance is what they'll call it now. Now it's no longer just copay. You have your copay, and then you have your co-insurance. And that can change depending on what you get done during that appointment because it's a percentage of whatever is charged. So those are the type of things that patients don't understand about their insurance that then ends up being even a breakdown in the care that they're getting with their provider, because then it kind of even creates almost like a distrust with their organization that they're seeing because they're thinking like, oh, well, they're overcharging me or they're not charging my insurance or they're not this, that, and the other. Anytime you have a question about this, the best place for you to look, it's one of the places that most patients don't even know to look. They get it in the mail or you get it as an email and nobody pays attention to it. It's called an EOB. An EOB stands for Explanation of Benefits, which means this is where the insurance company says, hey, you used your insurance card here at this organization. You were seen on this date and this is what you had done. This is what they charged you. This is how much you may owe. And the reason they say this is not a bill is because often if you have a copay of $25 and you pay that $25 when you go to the visit, even though on your EOB, Explanation of Benefits, it says $25 copay, you may have already paid that. So you're done, right? Now, patient responsibility, if your deductible is not met, it'll say PR, patient responsibility on your EOB, meaning that's your responsibility that you need to pay. Whatever's left, that might be back to that fictitious number that I came up with, 175 out of the 200. That 175 may be your responsibility as the patient up and until you meet that deductible amount. So taking time to check your EOB, taking time to understand what your deductible is, when your year plan begins and ends, what happens after you meet that deductible. Do you roll into a 100% the insurance pays for everything? Or is it a 80-20? You know, what happens after you meet that deductible? Understanding all of those things before you start to see providers, and it doesn't matter what provider it is. Understanding that will save you a lot of headache. I've seen patients run away from provider. Oh, that last provider, they were charging me a bunch of money. And it's like, you know, that deductible follows you everywhere. So now that you go to another organization, it doesn't change. It's the same thing. That deductible is given to you not by that provider. Those are terms that are set into stone by you and whichever insurance organization you decide to panel with. The provider doesn't care how they're being compensated. It could be cash, it could be PayPal, it could be whatever. If it's insurance, that's fine too. But then you both go into a contract with the insurance where you have to follow the rules and regulations of that insurance plan in order for that insurance plan to reimburse. So taking that time to really understand some of those key terms, and it really does get even more intricate and more detailed and so on and so forth. But those are some of the most basic things that if you understand those basic terms and you ask some of those questions ahead of time, it will save you a lot of headache.